Very good evening, all. This is Wednesday night's Vision of Asia, and I am Aditi Lamba coming to you from a remote location in New York City. Welcome to this episode, bringing forth South Asian voices during the coronavirus pandemic. We continue to follow top South Asian medical professionals as well as nonprofit organizations which are dedicated to raising awareness and support for the ones in need. Again, if you are an association or on the front line during COVID-19, be sure to reach us with your experience and email us on events@itvgo.com. Here are some pictures of recent donations to Brooklyn's ISKCON Temple by United Rudra Foundation and Royal Rice Company. Today, the global number of coronavirus cases surpassed 3 million, with more than 200,000 deaths. In the United States, the number has topped 1 million cases. Here in New York, Governor Cuomo said that the state will begin antibody testing on initial 1,000 transit workers in an effort to understand the spread of this virus, and again urged all to maintain the state's guidelines of social distancing, while states such as Florida, Georgia, California, and Louisiana are moving towards a reopening. We have tonight much on getting information on the conditions for reopening as well as hospitals, along with volunteerism during pandemic. But before the headlines, we'd like to send our condolences now for all impacted by the demise of iconic Indian actor Irfan Khan, who passed away at the age of 53 after a prolonged battle with cancer, leaving a huge void in the Indian film industry. The great actor was known for his incredible talents and versatility, a huge loss for Bollywood. He is survived by his wife and 2 children. Time tonight to start the episode now. Here are the headlines. India Center Foundation South Asian Arts Resiliency Fund gains momentum, featuring Priya, Giri, Desai, ITV Gold. The campaign against hunger feeds New Yorkers in need during COVID-19 crisis, featuring Dr. Melony Samuels, ITV Gold. Dr. Janish Kothari on coronavirus developments, testing, and frontline experience, ITV Gold. Allah on the other side of the break. Stay with us on Vision of Asia. Voice of the Community will be back shortly. Welcome back. I'm Aditi Lamba. This is Vision of Asia, special report on coronavirus impact, measures, and updates. Tonight's episode comprises of incredible nonprofit work we are seeing across the nation to truly help communities and entities in need. Here in New York City, the campaign against hunger has made it their mission to feed New Yorkers in need stronger than ever as we navigate through coronavirus crisis. Impacting many New Yorkers that have lost their jobs and also addressing homelessness and their needs, the campaign against hunger has provided for more than 1 million meals since this March and has served more than 125,000 individuals. We spoke with Executive Director and Founder Dr. Melony Samuels on the impact of the campaign through hundreds of pre-packed bags of nutritious food to families in need. Dr. Samuels also urged all to consider donating masks and support to the campaign against hunger, where a donation of $1 can make a difference. Here is the story.
How you are ensuring the safety of all of these volunteers that are working, because I know this is a fully volunteer-run nonprofit. What are the measures you've had to take for the safety and the security of all of the individuals that are volunteering, packing these meals, and also delivering them?
Okay, so it's been very tight for us. We finally are able to cultivate more volunteerism into the entire organization. We're finding individuals are not afraid as they were in the beginning. For the first 4 weeks, we could not get volunteers. Now we're getting volunteers. And what we've done is, of course, everyone wears a mask, everyone wears a gloves, and we still implement social distancing. And because of the amount of food that we have been distributing, we're now looking at moving our organization into a larger space, the warehouse part of it, the distribution for COVID-19, into a larger space. And hopefully in another few months, we can develop a hub for Brooklyn, where anytime there's disaster like this, the campaign against hunger can immediately respond.
Right. Are you currently looking for more volunteers, more members of the community to help?
Definitely. Definitely. We need volunteers. We need volunteers for so many things. Even farming. Right now, we need to grow our own food, and we have the ability to grow about 20,000 pounds of food. So even there, we need volunteers.
Yes, I want to reflect on something that was actually posted by your website where you said that, the campaign against hunger is actually noticing and witnessing a vastly disproportionate economic and social impact of COVID on these struggling New Yorkers. And there's an increased number of New Yorkers in need of emergency food and services to meet the basic needs of the families. Could you reflect on what kind of, disadvantages you've seen in the community in the last couple of weeks when you're talking about this increase in need of food? If we could help the audience understand what is this need and how big this need is, I think it would be a really interesting, perspective to have.
Well, we're seeing a lot of our Black Brown community members that are coming needing food. And of course, this virus, as you've known, it has attacked everyone worldwide, and we understand that. But when we look at our community, it's those that are on the verge of poverty or those that are working poor that we're seeing. Originally, we were serving 51% of the working poor. Now, what we're finding is that those that are accessing our services have never accessed our service before. So they are families that are definitely strong working families that have found themselves in a place that they've never been, and they don't want their children to go hungry or their families, and so they're online. So it's of course disproportional when you consider that there are others that don't have to worry, even though COVID-19 is here and it's affecting so many. There are some people that are fluent enough that they stay home, they get some of their food delivered. It is not so with those that are living in our community. And so we find that so many families have told us over and over again, they never dreamt that they would ever be on a pantry line waiting for an hour to get food.
What do you say to these families when they come to you and you see that uncertainty or, perhaps disappointment? What do you say to them?
What It's very hard to speak to everyone because you're keeping the social distancing. Years ago, you'd offer a hug or a handshake. That's not anymore. So what you have to do, because everybody faces mask, so you're trying to show, giving them the attention they need. And I find that being warm, courteous, kind, speaks a lot more to the need of families. Explain to them why they're waiting. Explain to them, as even when we're running out of food, just say to them, we're running out of food, but this is what we have. Explain to them, you can come back, but this is what we have. And what we've found is that that a lot of families are very pleasant. They're not aggressive. They're not very, 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 very angry about anything. We find that they're patient. They're very kind. They understand the risks we're taking. And so they're very supportive to what we're doing. And it's easier to serve them. I'll be honest, it's very easy serving these families because they all understand that this is a pandemic.
Right.
And New York City is the epitome of it all.
Nonprofit India Center Foundation is a New York-based organization which is dedicated to Indian performance arts and culture with an aim to be the American home for dialogue, debate, and education. India Center has now created a South Asian Arts Fund, a grant program to benefit South Asian artists as well as arts workers in the United States who have been impacted by the economic fallout of COVID-19. We spoke to co-founder Priya Desai on this fund and the direct response of India Center Foundation to support South Asians who have lost their incomes due to the cancellations of public gatherings, events, concerts, and much more. Visit indiacenter.us for more information. Here is Priya Giri Desai urging all to help community members.
At the South Asian Arts Resilience Fund that you have going on, talk to us about the kind of artists that you are right now representing through this funding, and also how many artists are you hoping to reach out to through this massive fund that you've started?
Well, I'm really proud to say that the India Center Foundation, we put in $20,000 of our own dollars. We also have a GoFundMe campaign going on for really all of us in the community to pitch in on this effort. We continue to raise money for it. And the way this works is So long as there are funds, we will keep giving out grants. Round one of the grants just closed, and we were very, very pleased to see that we got about 120 applications for grants. These are going to be about $1,000 each, and they're going to really compensate artists for about 4 to 6 weeks of work. And the artists had to tell us what their financial loss had been during COVID-19. They also had to sort of show us what their commitments to the arts really were. They did that by showing us samples of their work. They gave us a description of the kind of thing they'd want to do with this money that we're going to give them. And our hope, honestly, is that with the support of the larger community who see themselves in this work, you know, you, me, the audience of this show, we all are represented by the things that these artists do. We're hoping that we can keep this fund going. So if you think about it, $1,000 grant, you know, $1,000 per artist adds up. So 20,000 isn't going to take us too far. We are going to need a lot more to keep this going and to keep all the voices alive. And to answer your question about what kind of artists we are representing, so far, I'm really pleased to say that, you know, of those 120 applications, they run the gamut. They come from, you know, as far as their South Asian descent, they come from all over the subcontinent, and it's all over South Asia. It's not just India, Pakistan, Bangladesh, Afghanistan, Sri Lankan artists, and we have received applications from dancers, from performing artists, musicians, filmmakers. And we've also received and are accepting applications, not just from the creators themselves, but from the small arts organizers who help these people get their stuff seen. So, you know, if you are, I'm thinking of an organization such as Indie Meme, which is a small film festival organization in Austin, Texas. It's run by really largely a group of volunteers. They bring the most incredible independent films from South Asia to an audience in Austin, and Austin loves them.
For an audience to understand how badly some of these artists could be suffering, could you highlight on that, please?
Sure. Well, you know, it really depends on an artist's particular predicament. Some have day jobs because they have to be able to finance their lives. And some, you know, have gone all in. You know, they are screenwriters, they're musicians, they are filmmakers, you know, they do this for a living and they go gig to gig. You know, this term gig economy is something, you know, we've been hearing more and more with the likes of Uber, but artists have been gig workers forever. You know, they have been taking gig jobs their entire careers. Gig jobs have basically gone away. There's, you know, if you are 100% an artist, 100% of your time, you are no longer finding work in public spaces. You know, you can't be a filmmaker because there's nowhere to show your film publicly. You can't film your film that you might have had in production. If you are a musician who had a 10-city tour lined up for the summer, all those shows have been canceled. All those theaters are shuttered, or all those nightclubs. If you are a visual artist who finally got a gallery to present your work, the gallery shut down and they can't invite anybody to see the work. So the idea of public gathering and, you know, kind of common communal experiencing of art, it's gone. That is the lifeblood of art. You know, art brings us all together, and we physically can't do that right now, and that's why artists are suffering.
What kind of programs could they look forward to, some of the benefits that they can look forward to from the India Center Foundation and this fund in the next coming weeks, so that they can perhaps, you know, reach out to you? I would like for you to highlight some of that as well. Sure.
Well, round one of the grant has already closed. We actually, you know, we received those 120 applications. So we are now in the process of assessing those applications, and we will give out a first round of grants. We plan to give out a second round of grants, and that application cycle is actually open right now. So between now and its next deadline, which is all on our website, theindiacenter.us/artsfund, artists can apply for these $1,000 grants. It's a fairly simple application, and that is sort of the frontline way that we can start helping artists. The other thing that I think we plan to do once we start giving grants is giving at least a virtual platform to all these artists and their work. We can start, I think one of the huge benefits of contributing to the fund, of being a donor, is that you kind of will get a first look at some new things that are getting made. So if an artist is working on a piece, if a musician is composing something, if a dancer needed, time and space to, maybe make a piece of music that she was choreographing a piece to, we all are going to get a nice first look at those things. And again, this is about communal experiencing of art as it happens. So that's the kind of exposure that we hope we can give to more South Asian artists in the US.
It's time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. Today, President Donald Trump and infectious disease official Dr. Anthony Fauci said that an experimental antiviral drug might help fight coronavirus, saying that data shows it appears to help patients hospitalized with COVID-19. This is opening a door to the possibility of a treatment, while currently there are no approved treatments or vaccinations for the highly contagious novel coronavirus. In the United States, we have more than 1 million cases and more than 59,000 deaths, with now news of flattening of the spread of the virus. Bringing in a perspective on these numbers and understanding the current developments in treatment and trials, we spoke with Dr. Janish Kothari recently with his experience on the front line and his strict advice for social distancing. Here is Dr. Janish Kothari on coronavirus.
The knowledge and understanding that we have of this novel virus is changing rapidly, and every day we're learning something new. And it's really hard for the common person to sort of keep track with this stuff, and it gets a little confusing. And what we do know that this virus causes a respiratory tract illness, and it can range from a common cold to a potentially life-threatening respiratory distress syndrome. The initial reports had compared the virus to influenza, and they said that there's certain similarities. And earlier on in the disease course, we've quickly learned that there's not a lot of similarities to this, and in fact that this virus is far more lethal. The initial projections had said that, not the initial projections, but what we know about the flu is that on an annual basis, it causes mortality in about a little less than 1% of the people that are affected. But it affects a significant amount of people, hundreds of millions. So if you take less than 1% of that, it's still a good amount of people. And this data was presented by the New York Times. And although it's unclear at this time, the death rate from COVID-19 appears to be much higher than that. They looked at some of the evidence from Wuhan, China, and some of the different provinces within China itself. And the death rate at that time ranged anywhere from 1.5% to as high as 15%. And we haven't really conducted our own studies along those lines, but what we have noticed is that the virus is affecting people based off their location, their ethnicity, age demographic, comorbidities, the length of hospital stay required. There's a recent article that was published by a medical journal called JAMA Network, and they basically gave alarming statistics saying something like those patients that are ventilated, having to have the tube inside of their mouth, there's about 88% mortality in these people. So it's really hard for us to say, hey, anybody that gets this virus, there's a mortality rate of 5%, because there's so many subsets of the patient population that's affected that are responding differently. So it's really hard to put one number on it.
So, when accounting for that, how would you address another occurrence of this virus? Dr. Anthony Fauci actually said that the second round of coronavirus is unavoidable. Could you reflect on then how much we have to be concerned about this happening again while you're still dealing with such a high number of cases on a daily basis?
Well, there's absolutely a concern for recurrence, and in fact, I think it is also inevitable. I frequently find myself having this conversation with my friends and colleagues alike, and yes, the numbers are going down or sort of kind of plateauing, but this does not mean that the virus is going away, We still have no cure. And we don't have a cure or a vaccine or any truly tested option that's currently available. And the only major dent that we've been able to make in this whole process is the conduct of social distancing, And so right now, all we've done is pretty much put a Band-Aid on the bleeding. And, the minute we open up the economy and retract the orders of social distancing, the virus is going to be able to find new hosts to infect. And, we very well may see another wave, and perhaps this wave will be a little bit more robust than the initial wave. And I always remind my patients and my family members and patients' family members and anybody that I speak to that's not in the medical community that the virus has not gone away just because the numbers are going down. And it's pretty much merely waiting for more hosts to find when they decide to finally come out of their homes when it's time.
Well, so this kind of brings me to one of the most important questions that we are nationwide discussing it today, reopening. As you and I are speaking from New York City, which is the epicenter, some states across the country are applying to reopen or are reopening right now as we speak. What's your medical take on, the requirements for reopening? And when we're looking at a location like New York City, which is the epicenter where you're also working, is reopening really something that we can consider right now while we are coming towards the month of May?
So the idea of reopening is an interesting topic, and there are people on both sides of this line, and it becomes very difficult to kind of pinpoint which is best. If you talk to a medical personnel, they're going to tell you that, we're not ready yet. If you talk to somebody that's not in the medical profession, who owns a store, who can't, provide money for their family to put food on the table, and they have to pay their rent because they own a shop in New York City, they're going to have a completely different take. And then you look at people from different parts of the country, somewhere in Idaho or Iowa, compared to somebody in Los Angeles, Seattle, and New York, who have been afflicted a lot different. And to kind of have these social distancing and quarantine orders across the country, you can't really compare everybody from these different places and treat them similarly. But for me, as a medical perspective and working in New York City, one of the, if not the most afflicted place in the country, I think that the states that are beginning to kind of ease these stay-at-home restrictions, none of them have met the criteria that the government has said, that they need to see a steady decline of 14 consecutive days of people that have been testing positive, and nobody really has met that.
Dr. Kothari, this kind of brings me to a very important question that everyone is asking, which is, how much of this is dependent upon testing as well as then getting some more treatments out? Today, a huge, pharmaceutical giant in this country, revealed that there's a positive data in study for potential COVID treatment. It's an antiviral drug, and then we're hearing other medications, other treatments. So if you could reflect on what this is going to be based on and also what's happening in these treatments, I think that'd be really great.
Right. So the company I think you're referring to is called Gilead. And even when we spoke last time, there was a medication that was out called remdesivir. It's an antiviral medication that's been used for other conditions in the past. And at that time, it was gaining some headway about being a potential treatment for this disease. And actually just today, they released some preliminary results about coronavirus, which showed that there about 50% of the patients that were treated with a 5-day course of this drug, they showed some improvement, and more than half were actually discharged from the hospital within 2 weeks from their admission date and from when the drug was started. But you have to take this with a grain of salt. This was a single-arm study. And for those out there that don't know what a single-arm study is, that they really only just looked at the drug in these patients. They didn't have a control group to compare to patients that also had COVID-19 who did not get the drug. So it's really hard to make a comparison between the two, because you have to, match up a lot of the data to make sure that the studies are even on both sides. But with any clinical trial being run in the light of a pandemic, time is of the essence, and it would be impossible to sort of expect this type of study to be conducted. What Gilead was able to do is to make a conclusion that a 5-day course seemed to be better than the 10-day course in terms of outcomes, side effects of toxicities and things like that. And actually FDA, there's some chatter among the medical community that the FDA will actually approve this medication for emergency use in certain COVID populations.
Right.
And the other thing I think is my hospital actually started enrolling in this study too. So we're going to be actually giving, it just happened today, so we haven't started it yet, but we're going to be giving it this medication to a certain subset of population based on the guidelines given by the FDA, just to kind of make sure we, stay up to date with what the expectations are. And hopefully we'll have some more information about that.
And this is all for our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.